Peripheral neuropathy affects over 20 million Americans, with people over 60 accounting for approximately 70% of all cases. This progressive nerve damage causes pain, numbness, weakness, and balance problems that destroy quality of life and independence. Yet, most cases go undiagnosed for months or years because the early warning signs are subtle, easily dismissed as minor annoyances, or mistakenly attributed to normal aging changes that supposedly everyone experiences after 60. As board, certified neurologists who have diagnosed and treated thousands of neuropathy patients over 40 years of combined clinical practice, we see the same tragic pattern repeating itself in our offices and hospitals. Every single week, patients come to us after suffering for years with symptoms they didn't recognize as nerve damage. They assumed their feet hurt because of arthritis or simply from being on their feet too much. They thought numbness was from poor circulation or just getting older. They blamed weakness and balance problems on inevitable aging. By the time they finally seek specialized neurological help, significant irreversible nerve damage has already occurred in their peripheral nervous system. What makes early recognition absolutely critical is that nerve damage is relentlessly progressive if the underlying cause is not identified and treated. Once peripheral nerves are destroyed, they regenerate extremely slowly at approximately 1 millimeter per day, and in many cases, they do not regenerate at all. Catching neuropathy early, identifying the underlying metabolic, toxic, or inflammatory cause, and starting appropriate treatment can prevent further damage and sometimes allow partial nerve healing. Waiting until symptoms become severe and debilitating means living with permanent disability that could have been prevented. Research from the Journal of Peripheral Nervous System examined diagnostic delays in neuropathy patients across multiple medical centers. Studies found that the average time from initial symptom onset to accurate diagnosis was a shocking 18 to 24 months. During this prolonged diagnostic delay, nerve damage progressed relentlessly, destroying more nerve fibers month after month. Patients who were diagnosed and treated within 6 months of symptom onset had significantly better functional outcomes, less pain, and better quality of life than those diagnosed after 2 years of suffering. The fundamental problem is that neuropathy symptoms are nonspecific, varied, and easily confused with other common conditions affecting older adults. Different types of nerve fibers can be selectively affected depending on the underlying cause. Sensory nerves carrying feeling and sensation from skin to brain, motor nerves controlling voluntary muscle movement, and autonomic nerves regulating automatic unconscious functions like blood pressure, heart rate, and digestion can all be damaged independently or together. The symptoms you experience depend entirely on which specific types of nerves are affected and how severely they are damaged. In this comprehensive video, we'll examine 10 shocking signs of neuropathy that people over 60 experience regularly but rarely recognize as indicating serious nerve damage. Number 5 involves a symptom so unusual and unexpected that 80% of patients experiencing it never mention it to their doctors. Yet it indicates severe small fiber neuropathy requiring immediate aggressive treatment to prevent progression. Number 1 is the most common early warning sign, but is almost always dismissed as something completely unrelated to the nervous system. These aren't vague, nonspecific symptoms that could mean anything. These are specific, recognizable changes indicating your peripheral nerves are being actively damaged right now. Complete medical references for all studies mentioned appear in the video description. Understanding these warning signs allows early diagnosis and treatment before permanent, irreversible damage occurs. Now, let's examine exactly what your peripheral nerves are telling you when neuropathy silently develops. Sign number 10. Burning pain in feet that worsens dramatically at night and completely disrupts sleep. Starting at number 10 is burning pain in the feet and toes, particularly pain that intensifies dramatically at night. This is one of the most common neuropathy symptoms reported by patients. Yet many people suffer for months or even years before making the connection between their burning feet and underlying nerve damage. The pain is consistently described as burning, like feet are literally on fire, or scalding, like standing barefoot on red, hot coals. The intensity ranges from mildly uncomfortable and annoying to completely excruciating and unbearable. What makes this symptom particularly characteristic of peripheral neuropathy rather than other foot problems is that it worsens predictably and dramatically at night when you lie down to sleep. Patients universally report that pain is tolerable or even mild during the day when they're active and distracted, but becomes absolutely unbearable when lying in bed trying to sleep. Even light bed sheets touching the skin on their feet cause intense pain described as feeling like sheets made of sandpaper scraping burned skin. Sleep becomes completely impossible for many patients. They spend nights pacing, soaking feet in cool water, or sitting in chairs because lying down makes pain intolerable. This characteristic nocturnal worsening occurs because nerve sensitivity and pain perception both increase significantly when you're inactive, lying still, and focused on internal bodily sensations. Rather than external stimuli, during the day your brain is distracted by activities, work, conversations, and environmental stimuli. At night, in a quiet, dark bedroom, your brain has nothing to focus on except the abnormal pain signals coming from damaged nerves. The underlying mechanism involves damaged small sensory nerve fibers called C fibers and A delta fibers that normally detect pain and temperature. When these small fibers are damaged by diabetes, vitamin deficiencies, toxins, or other causes, they begin firing spontaneously and erratically, creating intense burning pain sensations even without any actual injury, inflammation, or heat stimulus applied to the feet. Research from the journal Pain Medicine examined burning foot pain characteristics in neuropathy patients. Studies found that burning pain was present in 60 to 70% of patients with diabetic peripheral neuropathy and other small fiber neuropathies. The pain severity and intensity correlated directly with the degree of small nerve fiber loss, measured objectively by specialized skin punch biopsy showing reduced nerve fiber density. What you absolutely must do if you experience persistent burning foot pain is seek medical evaluation promptly rather than suffering in silence. Don't assume burning feet are just from being on your feet all day, wearing uncomfortable shoes, or normal aging. Persistent burning pain, especially pain that predictably worsens at night and disrupts sleep, indicates nerve damage until proven otherwise through proper testing. Your doctor should perform comprehensive neurological examination, testing sensation to light touch, pinprick, vibration, and temperature in your feet and legs. Blood tests should systematically check for diabetes and pre-diabetes with hemoglobin A1C and fasting glucose, vitamin B12 deficiency, which is extremely common in older adults, thyroid disease, kidney disease, and other common causes of neuropathy. Nerve conduction studies and electromyography objectively test how well large nerve fibers conduct electrical signals. Specialized skin biopsy can directly measure small nerve fiber density. Sign number 9. tingling and pins and needle sensations in hands and feet that never completely go away. Sign number 9 is tingling and pins and needle sensations, medically termed paresthesias. This symptom is extremely common in peripheral neuropathy, affecting 70 to 80% of patients at some point during their disease course. The sensation is consistently described as tingling, exactly like when your foot falls asleep after sitting cross-legged, pins and needles pricking the skin from inside, or buzzing and vibrating. Sensations like a cell phone vibrating constantly against your skin. Paresthesias typically start in the toes and gradually spread proximally up the feet into the ankles and lower legs over months to years as nerve damage progresses. In the upper extremities, tingling characteristically starts in the fingertips and spreads gradually up the fingers toward the wrists and sometimes forearms. This distinctive pattern, called stocking, glove distribution because affected areas correspond to where stockings and gloves cover, is highly characteristic of length-dependent peripheral neuropathy. Affecting the longest nerves first, the underlying mechanism is similar to burning pain. Damaged sensory nerve fibers send abnormal spontaneous signals that are interpreted by the brain as tingling and pins and needles. Unlike burning pain, which primarily suggests small unmyelinated fiber damage, tingling often indicates larger myelinated sensory fiber involvement. Research from the journal Neurology examined paresthesias in neuropathy patients longitudinally over years. Studies found that tingling was very often the earliest symptom patients experienced, appearing months to years before pain, numbness, weakness, or other symptoms developed. Critically, patients who sought medical evaluation and treatment when tingling first appeared had significantly better long-term outcomes than those who waited until more severe, debilitating symptoms developed. Sign number 8, progressive numbness in feet, making it increasingly difficult to feel the ground when walking. Sign number 8 is numbness, the progressive loss of normal sensation in feet, legs, hands, and arms. Unlike tingling, which represents an abnormal sensation, numbness represents absence or severe reduction of normal sensation. You cannot feel touch, pressure, vibration, or texture properly. You cannot tell if surfaces are rough or smooth. In severe advanced cases, you cannot feel your feet at all, describing it as walking on wooden stumps or blocks rather than living tissue. Numbness develops insidiously and gradually as sensory nerve fibers are progressively destroyed over months to years. Early in the disease process, you might notice mildly decreased ability to feel light touch or distinguish temperatures. As damage accumulates and worsens, you progressively lose ability to feel pain and temperature, which initially seems like it would be beneficial but is actually extremely dangerous. The critical danger of numbness is complete loss of protective sensation. You cannot feel injuries when they occur. Diabetic patients with severe neuropathy step on sharp objects like nails or glass, develop painful blisters from poorly fitting shoes, or severely burn their feet in excessively hot bath water. Without feeling any pain whatsoever warning them of tissue damage, these completely unnoticed injuries easily become infected. Infection spreads into deeper tissues and bone. Tissue dies and becomes gangrenous. Amputation becomes medically necessary. Research from the journal Diabetes Care examined foot injuries and amputations in diabetic neuropathy patients. Studies found that over 80% of diabetic foot ulcers that ultimately led to lower extremity amputation occurred in patients with complete loss of protective sensation from advanced peripheral neuropathy. These patients could not feel pain warning them of injury, allowing minor problems to become catastrophic. Sign number 7, electric shock sensations shooting randomly through legs or arms lasting only seconds. Sign number 7 is sudden electric shock sensations described as sharp stabbing pains shooting through extremities, exactly like being shocked by household electricity. These intensely painful sensations last only seconds, but are severe enough to make patients cry out or jump. They occur completely randomly and unpredictably throughout the day and night without any obvious trigger. Electric shock pains, medically termed lancinating pains or shooting pains, indicate irritated or damaged nerve fibers firing sudden abnormal bursts of electrical activity. Different from the constant burning pain characteristic of small fiber neuropathy, electric shock sensations typically suggest larger myelinated fiber involvement or nerve compression. Research from the Journal of Pain examined lancinating pain characteristics in various neuropathy types. Studies found that electric shock sensations were particularly common in certain specific neuropathy types, including chemotherapy, induced peripheral neuropathy from cancer treatments, and nerve compression syndromes. The frequency and intensity of shock pains correlated with severity of nerve fiber damage visible on specialized high-resolution nerve imaging. What you must do is report electric shock pains to your doctor for proper evaluation and treatment. These particular pains often respond very well to specific medications, including gabapentin or pregabalin, that stabilize nerve cell membranes and prevent the abnormal spontaneous electrical firing. Causing shock sensations. Sign number 6, progressive muscle weakness in feet and hands affecting daily functional activities. Sign number 6 is muscle weakness, indicating that motor nerve fibers controlling voluntary muscle contraction are being progressively damaged. Weakness typically develops after sensory symptoms like pain, tingling, and numbness have been present for months to years, though in some specific neuropathy types, weakness appears early as age. Presenting symptom in the feet and ankles, weakness causes foot drop, where you cannot lift the front of your foot and toes properly during walking. Walking becomes difficult and abnormal with a characteristic slapping gait. As the weakened foot hits the ground uncontrollably, you trip frequently on small obstacles, curbs, or uneven surfaces that you previously navigated easily. In the hands, progressive weakness causes increasing difficulty opening jars, turning door knobs, buttoning clothing, writing, or picking up and manipulating small objects. The mechanism involves motor nerve fiber damage and death, preventing normal electrical signal transmission from spinal cord to muscles. Without nerve signals reaching them, muscles cannot contract properly or generate force. Over months to years, chronically denervated muscles atrophy, becoming progressively smaller, weaker, and eventually non-functional. Research from the journal Muscle and Nerve examined motor nerve involvement in chronic neuropathy. Studies found that clinically significant motor fiber damage and weakness occurred in 40 to 50% of patients with long-standing chronic neuropathy. Development of weakness was strongly associated with significantly worse functional outcomes and quality of life compared to purely sensory neuropathy without weakness. What you absolutely must do if any degree of weakness develops is seek urgent neurological evaluation. Motor nerve damage can progress rapidly and is often irreversible once established. Early aggressive treatment of underlying causes may halt progression and prevent further weakness. Physical therapy and occupational therapy help maximize and maintain remaining strength and function. Sign number 5, complete inability to sense temperature accurately, leading to serious burns and cold injuries you don't feel. Sign number 5 is the shocking symptom that most patients never spontaneously report to their doctors, but indicates severe small fiber neuropathy. Complete loss of accurate temperature sensation means you cannot reliably feel or distinguish hot from cold. Patients unknowingly burn themselves severely with excessively hot water in showers or baths, heating pads left on too long, or hot food and beverages without feeling pain warning them of tissue damage. Conversely, they develop frostbite and cold injuries from prolonged cold exposure without realizing their feet or hands are literally freezing. This particular symptom is extremely dangerous because temperature-sensing nerve fibers are small unmyelinated C fibers that are preferentially and easily damaged in small fiber neuropathy conditions. When these specialized thermoreceptor nerves are destroyed, you completely lose the crucial warning system that normally protects you from thermal injuries. Research from the journal Neurology examined thermal sensation testing results in neuropathy patients using quantitative sensory testing. Studies found that complete inability to accurately detect temperature differences of 5 degrees C or more indicated massive small fiber loss. Patients with severely impaired temperature sensation had extremely high rates of serious thermal burns requiring emergency room treatment and sometimes hospitalization. The truly shocking part that most people don't realize is how many patients have completely lost temperature sensation without knowing it. Research studies using standardized quantitative sensory testing equipment found that 40 to 50% of diabetic peripheral neuropathy patients had drastically impaired temperature sensation, but had never mentioned any temperature-related injuries to their doctors because they simply didn't connect the burns and injuries to underlying nerve damage. What you absolutely must do immediately is test your temperature sensation. Fill 2 bowls, one with cold tap water and one with comfortably warm water. Close your eyes. Have someone else place your foot in one bowl. Can you accurately tell whether the water is cold or warm? Repeat multiple times, randomly alternating bowls. If you cannot consistently distinguish cold from warm water, you have lost protective temperature sensation and need immediate medical evaluation. Additionally, take stringent precautions to prevent thermal injuries. Always test bath water temperature with your hand before stepping in. Never use heating pads, hot water bottles, or electric blankets on numb feet or legs. Wear warm insulated socks and boots in cold weather. Check your feet daily for any injuries. These simple measures prevent devastating burns and frostbite. Sign number 4, progressive balance problems and frequent unexplained falls, indicating proprioceptive nerve damage. Sign number 4 is balance problems and frequent falling, indicating damage to proprioceptive nerve fibers that sense body and limb position in space. Proprioception is your unconscious sense of where your body parts are located without having to look at them. When proprioceptive nerves are damaged, you lose this crucial spatial awareness. Patients with proprioceptive neuropathy cannot walk safely in darkness or with eyes closed. They must watch their feet constantly while walking. They become very unsteady on uneven surfaces. They fall frequently, suffering serious injuries, including hip fractures, wrist fractures, and head trauma. Research from Gait and Posture examined fall rates in neuropathy patients. Studies found neuropathy patients had 3 to 4 times higher fall rates than age-matched controls without neuropathy. Falls were directly related to severity of proprioceptive loss, measured by vibration sensation, testing with tuning fork. Sign number 3, chronic digestive problems, including severe constipation, diarrhea, or gastroparesis from autonomic neuropathy. Sign number 3 is digestive problems indicating autonomic nerve damage, affecting nerves controlling automatic gut functions. Autonomic nerve damage causes delayed stomach emptying called gastroparesis, chronic constipation alternating with diarrhea, severe bloating, and unpredictable digestive symptoms. Research found 30 to 40% of diabetic neuropathy patients had gastroparesis, causing nausea, vomiting, early satiety, and dangerously unpredictable blood sugar control. Sign number 2, dangerous blood pressure drops when standing, causing severe dizziness and fainting spells. Sign number 2 is orthostatic hypotension, dramatic blood pressure drops when standing from autonomic neuropathy. Normal reflexes that constrict blood vessels when standing are impaired, blood pools in legs, brain blood flow drops precipitously. Severe dizziness and fainting result, causing dangerous falls. Sign number 1, persistently cold feet and legs that never warm up, even in warm environments. Number 1, the most common early sign is chronically ice, cold feet and legs. Patients describe feet feeling frozen regardless of room temperature or warm socks. This occurs because autonomic nerves controlling blood vessel dilation are damaged, preventing adequate warming blood flow. These 10 signs demand immediate medical attention. Early diagnosis prevents progression, which surprised you. Share in comments. Subscribe for more content. Thanks for watching.